So can you give us a demonstration of the NV bed?
Absolutely. What we'll do is we're going to put you in the bed.
Okay.
And then we're going to try red light therapy first. Red light's going to improve blood flow and help you with detoxification.
Okay.
And it also improves the collagen and elastin production by your cells in your tissue and your dermis. So your skin should improve its quality, its texture, its appearance. It'll help with blemishes. It'll tighten it up. It'll help you sweat. Okay, so you can detoxify all the toxins in your body, which obviously after the treatment you want to go and take a nice shower and get it all off you. So it also help you feel a whole lot better because it increases blood supply too. So it makes you feel good.
That sounds good.
Let's have you climb in, and then we're going to try red light therapy, and then we'll try the infrared, and I'll tell you a little bit about that after when we get to that point.
All right. Now normally I would do this with very little clothes on.
Yes, you would normally want to do it with very little, if anything, because the more body exposure you have, the less light deflection you'll have, and you'll get better absorption. The red light therapy will penetrate about 2 to 3 centimeters, whereas the infrared light will penetrate much deeper, about 8 centimeters. That's why it's great for detoxification. That's why it can penetrate your skull. That's why it can provide deep photon energy to your brain, improve energy function. Because remember, degenerative diseases of the brain are low energy states, right? So if we're able to provide direct light energy, photon energy, just like plants do, we're able to create energy in our cells, create ATP, and therefore help basically deter or deflect or reduce the possibility of developing these neurodegenerative diseases.
Wow.
So let's do red light. Oh, here's some goggles for you. And they're a safety precaution, but these lights have not been shown to cause any type of retinal damage or eye problems or anything like that. But we'll put it on there.
Okay.
And then we'll do a little red light therapy for your body. And it's going to be quite bright, but...
Okay, I'm ready.
All right, so you're going to feel a little warm too. Remember, I can program this to do red and infrared, so I can alternate the ratio and how much energy and how much time is of each one, depending what we're trying to get. We're going to get anti-aging, wrinkle effect, we're trying to get pigmentation or blemishes, we're trying to get energy, detoxification, pain. So that's the goal of this. So it goes low red light therapy for you.
All right, let's do it
with
all.
red light. There you go.
Hang it up. There we go.
How about that?
Wow.
Nice and bright.
Yeah.
About 3 centimeters of penetration, even through your clothes, but it's more effective without having a lot of clothing on, because I think that deflects the energy that we're trying to get into your cells to help provide the blood flow effect and the stimulation to our cells for rejuvenation. How do you like that?
Love it.
And it's kind of warm, huh?
It's better than the tanning bed.
Yeah, and you get a nice face treatment at the same time. All right, I'm going to turn that off, and then I'm going to show you how the infrared light works.
All right.
Now the infrared, we'll do it on the full bed. It also has a blue light therapy too on the body. So the blue light's for acne. And so we like to use blue light to kill acne, and it helps improve blemishes also. So we may use that in combination with red light therapy. So red light increases blood flow, increases collagen, elastin production to help heal the skin, cause a regenerative effect. Plus you get the antitoxin effect by the blue light by killing bacteria, which is a fantastic treatment. You see the lights on a little bit, but if you look really closely, you can actually see the little lights are very dim red or far red, and so it's penetrating very deep. But at the same time, it's just a different wavelength, and because that wavelength is different, it affects our body in a different way. And in this case, we're getting pain reduction, detoxification, deep light therapy to help restore and repair, photon energy to tissues like your brain tissues, so that we get this increased energy production, which helps in the detoxification process. How you doing in there? But there's no heat here, so people gets a little cool. That's why you alternate with the red light, because I think sometimes just getting infrared provides no heat. But pretty interesting, huh? And you have thousands of LED lights in here to provide treatment. All right, so let's stop that. And then now, I'm going to show you a little bit of the blue light therapy. So blue light is for acne and for scarring, and so what we want to do is we want to kill the bacteria, and then we want to treat it with the red light to increase blood flow and help the repairing process and thicken the texture of the skin to decrease the effects that we see with aging of skin and damaged skin. So in this regard, we're going to bring the face plate over your face, and we usually put it as close as we can to your face, like that. And then what we'll do is we're just going to do blue light, because that way for the purpose of the demonstration, you can appreciate what that is like. You ready?
Yeah.
Okay. There you go. And there's, you can see the blue light actually causing damage or death to the bacterium, and that also improves their scarring. But then along that, you combination that treatment with red light therapy, because you can alternate between them both, and you get a wonderful treatment in a short amount of time, and believe it or not, a very reasonable investment for you. Can you see? Can you appreciate that blue light?
Yeah.
Pretty cool.
Yeah.
All right, let me turn that off. And
That's great.
yeah,
That was fun.
yeah, it is kind of cool. Sit there and get out. You feel very relaxed. Feel more energetic. All the stressors kind of disappear.
Great.
Yeah. You need some help out of there?
I feel like
You just slide in there. Yeah,
I
you
feel
get.
like it's a coffin.
There you go.
All right. Well, thank you,
Yeah,
Dr.
you're
Allende.
welcome.
That was fun.
Yeah, it's fun. I enjoy providing treatments. Actually, patients feel the difference like right after they leave. They really feel
Yeah.
good, and I think the more persistent and consistent you are with your treatments, the better response you're going to see with time. I think that sometimes people want this magical response right away, but for the downtime, there's no downtime here. You get a great treatment, you just do repetitively to get the treatments, and you start to see magnificent changes over a period of time.
So how long have you had this bed?
I received this bed in 2019, so April 2019. So just over a year and a half ago. I was probably one of the first clinics in the West Coast to actually have it.
Wow.
Yeah.
So how did you find out about it?
I actually went to an anti-aging conference in Las Vegas.
In Las Vegas.
Yeah.
I know
got-
Dr. Bob.
Yeah. I got to sample the bed and read up a lot on the information that's available on it and how it works. And there's a lot of literature support its use. And I said I have to have one. If not for my patients, for my family too, and myself, we get all the benefits of having it. So I make it available to patients who want to use it.
Excellent. No, it's great.
This particular one was one of the very first upgrade models they did, and so the energy that this one produces is by far much greater than the original models they came out with, and so that's why there was a delay in us getting. Because I ordered the model in December of 2018, and they told me, well, because I ordered two.
Where's the other one?
Yeah, that one hidden. They said that, okay, well, you know what? They didn't want to send one bed out because they were making them as they went. They had just improved and increased the quality of the product. So they told me they don't want to ship it out until they actually had both upgraded to the new technology to provide the maximum amount of energy. Because the more energy these produce, the deeper penetration it performs, and it's not damaging. It's only healing.
Yeah.
And so it's a remarkable product, and so I waited, and so we got them a little bit mid last year, and I use it. I've used it because we avoid it in the summer for a lot of people. Because it's just get hot and they get sweaty, and they don't really want to. But sometimes they do want to come in for acne treatments, and so they do it regardless. But most of my clients come in the wintertime, fall, winter, and early spring.
Great. All right. Thank you so much for
Yeah.
showing us this.
My pleasure. It's awesome. I love the machine.
Great.
And just in case people get scared, they hit the button there, and they can
Oh,
stops
good.
it, resets it, and it shuts down. But like I said before, the red light and infrared light is not a damaging light. And in fact, one would argue that it could probably improve every single cell in your body's function, including the retinal cells. So one would argue that there's nothing to be afraid of if you come in here and get a treatment. But we
Right.
provide the goggles because I think it's appropriate for that.
Okay.
Yeah.
John, you'll be seeing me again.
Yeah.
Okay. Thank you.
Thank you. Appreciate it.